Trying to grab all the groceries in one trip? Oof, not how you would have done that. You know sometimes less is more. Like when you drive less and save with the USAA annual mileage discount. USAA. Get a quote today.
Ladies, we meet you where you're at. Welcome to the Dare to Ask podcast, the bonus episode, our live event. I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with a woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
So this is our bonus episode, our episode number 12 in season 3 of the Dare to Ask podcast. The way we started this season, we finally had the opportunity to do an in-person live event, and we thought that was the most brilliant way to kick off our season 3. This was such a fun night. As host, I got to sit with 7 different panelists, each with an expertise, a lot of sense of humor, and just that casual vibe. The atmosphere was, we're sitting down and just having a conversation like girlfriends do. Since I've went to Essentia for myself and my children's needs for years now, I have a perspective that's very personal because of all of these amazing guests that I've had on this podcast over the years. It's created a new sense of intimacy, a safe space to be vulnerable and to show our personalities too. Part of my personal story is that I've delivered 2 babies at Essentia Health of my 5 children, and both experiences were beautiful in their own way, using Essentia Health's amazing midwifery program to personal trauma of a stillbirth, experiencing a loss like that. And I speak so highly about the care I was given during the hardest time of my life. Like so many women, I have a story. We all have stories. You just want that personal connection. This event was like a sample size of the care I've received at Essentia Health over the years, and I'm thrilled that we've turned this live event into a bonus episode for you. I hope you enjoy. Let's get to it.
Good evening, everybody. We are so excited to have you here tonight to our women's event, and I'm just going to go through a little bit of what to expect for tonight. My name is Dr. Stephanie Geffro-Ellison, and I have been at Essentia since 2004. I am currently the division chair for our Women and Children's Services, and just accepted a new position for Associate Chief Medical Officer. So I'm in a little bit of a transition, but Women and Children's has always been at the heart of the joy that I have working at Essentia. So tonight is a little bit about the services that we have and a lot more about having a good time. I'm going to share Corey with you tonight, reluctantly, because I will tell you I've had a girl crush on her for a long, long time, ever since hearing her on the radio, and then when she was a patient of ours at Essentia, and I heard her story, and I just really felt connected to her as a woman. I have had just the greatest time when we've gotten together for our podcast. So welcome, Corey. I'm going to turn it over to you.
Thank you. Dr. Geffro, I have to say, you by far have been one of my favorite guests on the Dare to Ask podcast, because you've never been afraid to get vulnerable and real with me. And almost every time we laugh and we cry.
True story.
It's a thing. So, girl crush mutual. Okay. In case you don't know, I'm Corey Jensen, and I do mornings on Bob 95. It's the #1 new country music station in town. I've been doing it for a long time. I've been in radio for over 20 years, and it's always been such a passion, but like a lot of women, we never have enough on our plates, so I always pile more on with being a wife and a mom and podcasting, and I do a little photography on the side too. And there's always stuff to do, right? Keeping it on, because that's what we do as women. But I have to say, one of my greatest pleasures over the last 3 years has been doing this podcast with Essentia Health. And I thought it was so important that, now that we're kind of in the place where we get to do live in-person events again, that we would do something like this. So when it was presented to me with Denise and Danielle, who are our coordinators, and Cassie, who's helped put this all on, I was super jacked to be able to come out here and have like some girl time.
Exactly. It's gorgeous. Thank you. Thank you for putting it together. We appreciate it.
Do you want to brag a little bit about Essentia? Talk a little bit about any services and the things that you guys do, because I'll fangirl all night. You know that.
Well, we have been growing quite a bit over the last couple of years. We added Dr. Wyatt for our maternal fetal medicine specialty program, and then we've recently added Dr. Erin Matzhold, who has helped build our urogynecology services. We have fertility services. We have full scope of midwifery services. We have nurse practitioners, and of course our physicians that work within our department. We just opened up a second location in West Fargo at the Lights, which it is a gorgeous clinic. It's been a little bit of a transition for us because we've been used to all being together. So we're going through that change, but I think everybody that's been working out there has been really happy with how that clinic has come together. We have a beautifully renovated birthing center and NICU, which is state of the art. And you know what? The thing that I love the most is every single person within our department absolutely loves what they do. Even when the work gets really hard sometimes, that joy and passion always comes through, which it's super special to be a part of that.
Anytime we do kind of an event, especially when there's a stage set up, even when it's as cute as this one, you get a little nervous, right? And I know that our panelists will be a little nervous, but we have to break the ice somehow. And I thought our perfect little challenge to each other is the perfect icebreaker.
For sure. You're not going to ask me to do it here, are you?
No, not this time. That's for another kind of night. Okay, it's going to have to be later. Okay, so in one of our podcast discussions, why, as women, why do we hide our panties and our bra when it's our annual visit? Why do we hide those? You do this too, because we don't want them out. Is that going to be offensive or something?
Yeah, and it's always way more neatly folded than it has ever been in my drawer at home.
Ever.
I wouldn't want them to think that I don't fold my underpants.
This became kind of a joke for us, and you did it first, and I'm so proud of you, because we thought, okay, let's do it. Let's not hide them. Let's just leave them out at the next annual visit and see what the doctor does when they see it out. And when you sent me that text message of the picture of her panty and bras in the middle of the floor.
So you'll meet Mandy, but when I had my annual exam, it just popped into my head. I was like, I have to do this. So I just left a nice trail of clothing all the way to the bed, and I just sat there and, smiled nakedly, waiting for her to come in the room, and she was like, oh my God. I don't know what she really thought, but I just thought it was spectacular. If I could have taken pictures of her, I would have, but she'd probably make me destroy them. So.
It was great. I can't wait, but my next visit is until next March, so I'm going to have to wait.
I'm going to hold you to it.
Okay, and you're going to get a picture from me, but now I'm going to have to challenge everybody here, because if we make it a thing, especially our lovely providers who are now going to see everybody littering the room with all of their clothes. This is just some of the kind of fun talk that we have on the Dare to Ask podcast. Now, 2 seasons deep, and we're about ready to launch into the 3rd season, which I'm super excited. Very first episode will launch season 3 next Tuesday, so we're going to keep that same. Every Tuesday, new episode drops. I know that there's even a couple providers who are going to be guests for season 3 that are here tonight, some even on the panel. So fun to dig into that. And if you haven't yet, even in your brochure, there's a little QR. You can just take a little picture, pull that up, and listen. Isn't that good?
It's awesome.
Okay, I'm about to introduce our panel here. I will let you go and find a seat and get comfortable. You're off the hot seat.
All right.
And you didn't even have to expose your panties and bra. Later, much later. Okay, before I get to everybody, I wanted to kind of have this opportunity to just tell you guys a little bit more, maybe about myself, and Stephanie kind of hinted on it. Before I had a professional relationship with Essentia, which is now going on about 5 years, when we decided to team up, be radio partners, but also social media partners and kind of spokesperson, because they knew what a fangirl I was of Essentia. I had that personal real experience. And it was about the time when I was expecting my fourth. So this was 8 years ago. And after having 3 other births and deliveries that were all natural, really great, my pregnancies were awful, but great labor and delivery experiences, I was still craving something that was a little more personal for me. In that research, all signs to Essentia Health. So I made that jump, and I'm so, so glad I did, because it was exactly what I was looking for. I knew that I wanted to look more into their midwifery program, and it was just, when you know you have the right fit, it's just the right fit, and it was like a glove right away. Once you have those connections with people, and I have had superb experience all along the way, through nurses and midwives to doctors to walk-in clinics and emergency room visits, everything has been really good. To scheduling my appointments, I've just had really good experience. And I've told so many people this, for me, it really isn't about the building or the walls, it's the people inside that make Essentia Health. So I'm always thinking about those people. And then 3 years ago, when it was brought to my attention that, hey, would you be interested in hosting a podcast for us? Got really excited. And it felt like it was the right fit and ready to do something that was unique, that took the clinical atmosphere and dropped it down to something a little more like a girlfriend. Let's get to know the provider in front of you and know her like you would a girlfriend you'd have coffee with. Overall, wonderful experience. And again, #fangirl. Let's introduce you to our panelists. And I'm really excited to introduce you to each of them. All right, first, Tessa Hand. Will you please come up here? Tessa is a certified nurse midwife, specializes in midwifery and gynecology. And I'm excited to have you up here, Tessa, because tonight is the first time we've met, which is exciting to get to know you a little bit more. Michelle Heller, which is Dr. Heller. Her specialty is gynecologic surgery and gynecology and obstetrics. We have another certified nurse midwife in Cassie Kurtz. Her specialty, midwifery, gynecology. She said, hi, friends. Dr. Erin Metzold, who is specializing in urogynecology. And Dr. Geffro had kind of mentioned, newbie to the team. This is one of those really exciting expansion and growth things that Essentia has done. Next up, we've got Dr. Caitlin Pandolfo. We have done a podcast together. We did video in Meet the OBs. We go way back. I mostly know you as a pregnant woman, but now you're not pregnant right now. Her specialty in fertility and gynecology and obstetrics. Another certified nurse midwife to introduce you to is Amanda Swanson. And again, I think we have done a number of things as well. I love that Essentia has always made it very important, especially with women and children's services, to be as hands-on and real as possible. And doing events like this, doing the podcast, kind of gives us that opportunity. And without further ado, Dr. Wyatt, Michelle Wyatt, who is specializing in maternal fetal medicine. Will you guys give them all a round of applause just to welcome? How's the nerves, ladies? We good? A little nervous? Oh, way up here. Dr. Pandolfo. I was just telling Stephanie, even though I've been doing it for over 20 years, radio, no problem. There's thousands of people listening. Don't even think about it. 50 people in the room and I got some butterflies. Let's talk women's health. If we all have something in common in the room, it is our health. Usually when it comes to women and our moms, we're doing it all, not just our health that we're having to think about. We're having to think about the husband, the wife. We have to think about the kids, and it's really a lot on us. And to help take some of that pressure away is when you get to ask some real questions and bring yourself back to your own health. I'm going to start tonight with Mandy Swanson, certified nurse midwife. You're going to to be first on the hot seat. How does care differ between an OB and a midwife? Break that down for us.
Sure, I'll do my best. We're lucky at Essentia. We have a team of both obstetricians and midwives. A lot of, I think, the care differences between us comes from the way we're trained. So obviously obstetricians are trained through medical school and residency. And as midwives, we're trained as nurses. We all are registered nurses, and then we go back to school to get further training to become a midwife. Mm-hmm. I would say midwives specialize in caring for low-risk pregnant women, and not necessarily most of them go through. The patient has a choice to choose whether they see an obstetrician or a midwife, but midwives are caring for our low-risk patients, and we're lucky in that I'm sorry, I lost my train of thought.
Happens to me all the time.
The care we can provide to them, especially when they're in labor, tends to be more low intervention just because they're low-risk patients. So, and when you're trained through the nursing field, a lot of us started as labor and delivery nurses.
God bless you.
Right. We are trained, we have extra training in caring for patients who tend to have unmedicated births. Mm-hmm. Obviously, not all our patients are unmedicated. Most of them aren't. Actually, most of our patients end up getting some form of pain management. But so we do our best to be in there with them, provide labor support measures. We talk to them about that in their prenatal visits as well. In the clinic side, the prenatal care is probably not much different between a physician and a midwife. All of us, both the obstetricians and the midwives, we just want to support what our patients want. We want their journey to be how they want it to be. If the amount of prenatal visits are the same, usually some of the physician patients are high risk, so they require extra monitoring, extra testing.
Yeah.
So that part of it might be a little bit different, but we tend to spend the same amount of time with our patients at our visits, and we do a lot of education. Everybody's going to get education no matter who they see.
How do you feel about this remodel? Talk about comfort and care for any woman going through labor and delivery.
Yeah. Our remodel is awesome because all the rooms have these big jacuzzi tubs. All the rooms now feel more like home and much less medical. And I think the patients have really appreciated that. They have their little fireplace. We try to make them as comfortable as they can, no matter who they're seeing. Obviously, it's been really nice, and I think the patients have really appreciated it too. Good areas for the support people to rest and be present as well.
Essentia Health wouldn't say this, but I'll say it. It's a little bougie. I mean, you feel good. They're nice rooms. They're really nice rooms. Thank you so much for that. Next on my hot seat, Dr. Michaela Heller. If nothing seems wrong with me, why do I still need to have that annual exam?
That's a really great question. I often tell my patients the annual physical exam or just those screening visits have multiple purposes. First of all, it's to establish care, and so you and your health provider, your physician, your midwife, your family practice provider, whoever it may be that you see, can really establish that rapport, get to know each other on a more personal level so that you have that trust built up when something does go wrong. Oftentimes, the second reason I talk to them that there are lots of things out there, lots of diseases, lots of cancers that we have good screening tests for and preventative measures against. And these are the times that we need to do those so that we catch those things early and can prevent either a cancer or a disease from developing further or offer care that is curative in most nature. It's another very important reason. And then offer a lot of education during these appointments with my patients because typically they are a little bit longer appointments than just a normal office visit. And so we have time to either talk about chronic disease management, chronic disease prevention, as well as in, specifically our specialty, talk about those preconception counseling things, talk about their future goals as far as family planning and life in general and health in general.
And if one of your patients left their panties and underwear out, how would you feel about that?
So in all honesty, I had to giggle at that. It is a dream of mine to print those memes off and put them in my office because I have to laugh. It is so true. Every time I see those on any social media platform, I just laugh because I do it too. You fold it up nice and neat and you tuck it under your jeans. You put your purse on top and then your jacket on top of that. What else are we looking at today? Why is it so private?
Yeah. It's crazy. As if you're not going to see everything we have anyway. We can't have you see your underwear in our bra. Thank you for that. I'm going to throw a couple questions out now, and these ones are good for anybody to chime in. So if you have an answer, and there can be multiple answers, first one to jump. Dr. Pandolfo, I'm going to ask you not to because you will just talk and never stop talking, and you'll be so loud. See, if I tease you, you'll feel more comfortable. Promise. Nerves will go down. Okay, here's the question. The most common awkward question you get asked. Anybody with a good Akko Taco question?
it's not a question, but I think probably over 50% of our people apologize for their hair that we do not care about.
One of my best friends in her first pregnancy, I had already had 2 kids, and she had called me and she said, okay, the hair. I'm about to have my first OB pants off visit where I set the standard. So whatever I go in on, I've got to maintain up until delivery. And I'm like, they don't care. So you're confirming you don't care. It's a really good one.
Remember the second we walk out of the room.
That's great to hear now that we've covered hair. Anybody else?
I guess I usually tell patients that there are no awkward questions.
Yes.
I get a lot of questions from people about sex, so it's okay to talk about those issues because they're important and they're very important for your quality of life. So
the hot question about sex right now. What's trending in 2023? Sex talk.
I don't know that anything is trending, but I did read some studies on vibrator use and how it improves sexual functioning. So,
anything you want to pass along to the girl, go ahead. They might want to know. It's okay.
The doctor says it's okay.
I will say more women I find feeling more and more comfortable to bring up these subjects and talk about them. Low libido, pain with sexual intercourse, whatever it may be. They're finding out that you no longer just talk to your girlfriends about it or in hushed voices. You openly bring up these conversations and find out that other women experience these and it's not normal and it's okay to bring these up to us because there are treatments.
Yeah.
We can help you.
Listen to the Dare to Ask podcast where we talk about this kind of stuff and have events like this, because the hope is that as a patient, as a listener, it is okay for me to actually ask that question at my visit. It's my visit. I can talk about whatever I want, and your provider wants to be able to be there for you is like the message that I think we just keep preaching and preaching. Next question, why? Why should I choose Essentia for my healthcare?
I think because of what you said, Corey, the people, and we have such a good team. We all support each other. We all want what's best for our patients, and we want to support what our patients want, their health and their journey through pregnancy and life, to be honest. Yeah.
As just a patient experience, when you brought up team, perfect way to describe it. Anything that comes up, whether it be my annual visit or my general practitioner, and I have a question, if that provider doesn't know, they're like, I'll get the answer for you immediately. I'm asking. I'm on my chart. I'm sending a question to somebody. We'll find out. We'll get you the answer. We'll get you what you're looking for. It's just that transparent, which has always been really nice. Anybody else have a different
I would add one. Oh. You should come to check out our new clinic at the Lights. It's so beautiful. And I love that pediatrics has a whole wing. There's family practice there. There's OB. There's midwives. There's NPs. There's fertility services, ultrasound, x-ray. Like, it's just really a one-stop shop. And I think that for me with young kids, I'm like, anytime I can do anything all in one space, I count that as a blessing.
It is. I agree.
And there's a parking ramp so you can wear nice shoes.
Hallelujah. So
you
good.
don't have to scrape your car when you leave.
It's the little things in life, especially for moms and women, that we really enjoy. This one is going to be for certified nurse midwife Tessa Hand. Let's talk baby blues versus postpartum depression. Interchangeably, I think people still have that misconception. I know for my mother's generation, it was all one and the same. You just called it baby blues. For grandma, for my mom, that sort of generation. But there is actually a difference, and you've got the answer on how to explain that.
Yeah, I really like talking about postpartum depression and postpartum anxiety. I feel like it's something that women are talking about more, and a common denominator is that we all have felt it to some extent. So I kind of explain those first 2 weeks after giving birth as a little bit of a roller coaster. There are a lot of emotions with that, but it's when it extends past those 2 weeks that it gets a little bit more concerning. Any times that you have thoughts of hurting yourself or your baby, also, we want to know about that right away. I always tell moms the ER is a safe space. We want to keep moms and babies together and make a plan to stay safe. So if you're having thoughts, that's a good place to go. But if you're at that 2 weeks and you're like, I just still am not feeling right, or the intrusive thoughts, the anxieties, that's when we want you to reach out to us. We want you to talk to us about it. And at Essentia, we check in with all of our moms at 2 weeks postpartum specifically for that. We want to see that things are getting better by then and not getting worse.
Thank you. That's a really great explanation. Extremely personal now, because you're in the brochure, your answer, when you threw out the vagina is self-cleaning. I actually knew that, but
Good. You learned something from all the podcasts.
I know. The vagina is self-cleaning, and what should we not be doing?
Sure. I think that's probably maybe one of the awkward, it's not awkward for me, but I think women feel awkward asking that. Like, what should I clean this all with? First of all, nothing is okay. And I also think it's a marketing thing right now. You see it every time you turn something on. There's some new wash that's going to get rid of something or do something for your vagina, and it is self-cleaning. You can just let water run over it. You should never clean anything inside of it. If you wanted to clean your vulva, which is the outside of your vagina, you could use a really mild soap, but you really don't even have to.
Thank you. Here's my personal, and it's weird. So my oldest and youngest, I have a 17-year-old daughter, which of course she knows everything. Then I have a 7-year-old daughter who is very impressionable and like a sponge, taking in everything, especially big sister has to say. So mom and dad, we were on a date night, and she was doing all the nighttime routine from bedtime to showers and homework like the rock star sister she is. Next night, she's at work, and I'm sitting down and talking to my two youngest. Ren is 7, Beckett is 9, and they're together, and we're talking about the day, and Ren just goes, and Genevieve told me we talked about washing my vagina and how I shouldn't use soap on it. Excuse me? Why? Why were you talking about this? And for whatever reason, my daughter had just bought some body scrub, and Ren wanted to use it, and she's like, don't use it on your vagina, though. That was the backstory I didn't know. But my 7-year-old was so confused. She's like, yeah, we talked about washing our vagina. And did you know if an ant crawls in your vagina, it disintegrates?
I didn't know that one.
Excuse me? So I immediately text my daughter, you have some explaining to do. What in the world is this? Her reply was, oh my God, that's what she took away from that? I was explaining about your pH balance and how no soap is necessary, and that the vagina has a pH at a level where if an insect were to go in it, it wouldn't survive. Well, she took away an ant is disintegrating in your vagina if it crawls in it.
What can't vaginas do?
Okay, thank you guys for hopefully getting a laugh out of that. All right, I've got another question, and this one's going to Cassie Kurtz, another certified nurse midwife. Can I see this team even if I'm not pregnant or even have any plans to become pregnant?
Yes. We see lots and lots of women for all different sorts of reasons. One of our main things is annual exams, and we do have our own patient following that we do their entire physical exam. And then we also have a lot of women that do have chronic disease that require having a primary care provider or internal medicine type of doctor. And so those women will come to us just for their women's health needs, so like their breast exams, their pelvic exams. We see a lot of women for things, all sorts of things really. If you do come to us and you need a physical exam and we find that you have something like high blood pressure or a chronic disease like new onset of diabetes, we will send you to where you need to be, but we can certainly start the process for all of those. We are a specialty, so we do focus on the women's health and mostly women's things. The docs do a lot of surgical consults and things of that nature. Preconception care, like we talked about, is super, super important, and we can cover that in the physical exams too.
Since I already said I had a teenage daughter, when's the age? Over the years, especially, that number has kind of moved a little bit.
Yeah, as far as what we can see for ages.
Or when the appropriate time is to finally see.
So as midwives, we can see anyone who has their period. So the start of their period is when we can start seeing girls, and we can see them all the way through menopause and beyond.
Patients before, like, say, their first pap smear, which is at the age of 21, especially if they're sexually active for STI screening, that does not mean that they need a full pelvic exam or an invasive exam with it. But it's also nice, too, to get to know that patient on that level before, again, you do a more invasive exam, like a pelvic exam. You know, I have a lot of patients with teenage daughters, and they're like, when should she come? And I'm like, she can technically come whenever, 16, 17, 18, even just to meet an OB and talk about the pelvic exam before she needs an appointment for one first. And again, that education piece.
That's good news. Everybody pause. I got to log into my chart and make an appointment now for my daughter. Thank you for that. I have got a question now for our urogynecologist, Dr. Erin Metzold. Pelvic floor problems. Here's what I'm loving about right now. It feels like people are more and more comfortable actually talking about pelvic floor problems now. And this covers a gamut of many different things. But when is that time where we finally reach out and talk to our doctor?
Yes. So there's also the question of what are pelvic floor disorders. And so basically what that means is just kind of a weakening or a changing of the pelvic floor as women age or through childbirth. A quarter of women may experience some form of pelvic floor disorder throughout their lifetime. So that means things like urinary leakage or overactive bladder, prolapse, or even pain with intercourse. Whenever these things become bothersome or they are, impacting your quality of life, that's when you should either seek care from an OBGYN, one of the nurse midwives, or myself. So,
To expound on that a little bit, there are actually treatments. Maybe a little bit of that, we don't talk about this. And you think, I'm just going to pee my pants forever. I'm just going to, every time I do a jumping jack or I sneeze, this is just my life now. But that's not necessarily the case.
Exactly. And so I usually go through with patients the whole gambit of the most minimally invasive things that we can do, which is oftentimes working with a pelvic floor physical therapist. And we have many wonderful pelvic floor physical therapists at Essentia, as well as medications or non-surgical options or surgery, but trying to figure out what works best for patients to kind of get their quality of life back so that they can do their jumping jacks, so that they can do the activities that they enjoy and not be bothered by those types of issues. Yeah.
And you don't have to steer your children away of having a Sky Zone birthday party.
Exactly.
Because you're like, mommy will be over here. Thank you so much. Once again, I'm just so happy that Essentia now has you and this department, and it's growing because it's obvious that we have a great need for it and people can actually find care.
I love it when people have that moment of, I've never been able to talk about this before, and they finally feel like justified in being able to talk about this and that it is an issue.
We jest and joke about like peeing our pants and whatever, but there's the whole sexual health element to your pelvic floor health as well. So you can really help out there.
Yeah, there's just so many things that women just don't like to talk about. And so I think being more comfortable having that dialogue at your well woman care visits, or if you're having more issues, coming to see me too. So,
And no spoiler alert, but look for season 4, Dr. Gaffro and I, the Sahara vagina. We're going to talk dryness. It's time, ladies. Let's jump over to fertility. And Dr. Caitlin Pandolfo, what are my fertility care options at Essentia Health? And then when is that intervention necessary? When do I start to think I need to seek care?
We can do everything up to the point of IVF at Essentia, which for most people is going to be all you really need. IUI, whether you're unexplained infertility or same-sex couple, that's where we can put the semen inside to try and get you pregnant. Medicated cycles, where we're just giving you pills and controlling the cycle until we're ready to trigger and say, yep, now's time to have intercourse the more natural way. And sometimes it's just a sprinkling of education, and that's all you needed from me, and you had success on your own. And that's probably my favorite, when you show up for your consult and I taught you a little something, and then you're ready to come in for your baseline to start the next cycle, and oops, I'm accidentally pregnant because we learned a little something and that was the trick. For most people, we say 12 months of trying and you're going to have success. If you're older than 35, not saying that we're old when we're older than 35, we use 6 months as our cutoff because we know that our fertility starts to decline after age 35 and then rapidly after 37. If you're coming to see me at age 40, I'm going to help you right away, whereas 35 is 6 months. Same kind of guideline or timeline for people who have irregular cycles or something where we're just baseline thinking maybe you're going to have a little bit more trouble, then we intervene at that 6 month or even sooner depending on what the diagnosis is. And that's the other part I love about people coming in for that little education visit, is because you might tell me something and I'm like, whoa, that's not normal. We should do this right away, not make you wait for 6 months or 12 months. And so you can figure out so many things if you just come in right away and we chat for a while. We don't care if you've met any criteria for us to intervene because it gives us a little time point to kind of check in and see where are we.
I have to give you a shout out because in our podcast episode that we did, and we've talked fertility, I think every season now, we've made sure to sprinkle that in because it's so pertinent. So many women suffer from it. So many men suffer from it. And the thing that you had shared, went vulnerable, was being able to bring added personal experience with your patients. And I I heard that several times with a number of guests. It really made me, once again, love Essentia, the ability that the providers have in getting personal and making a connection with their patients. Shout out. Listen to Dr. Pandolfo's Dare to Ask podcast. Do you think that that is an important element to have that personal connection?
I think so. People probably think that I'm a little too friendly when you come into the clinic because I'm just chatting and I forget that we're not best friends and we don't know each other outside of the clinic. But I think it helps because then you open up and you can actually ask me that really embarrassing question that I've heard 1,200 times and it's not embarrassing for me. It's probably a differentiator between us and elsewhere because we all talk to you like you're a normal person that I would visit with standing in the coffee line.
Yeah, thanks for that. Hey, guess what? I've got a question for you, Dr. Wyatt. Your specialty, maternal fetal medicine. We need to talk a little more high risk when it comes to pregnancies, and you're the person to go to on this because when we're talking factors, when are some of those first indicators?
There's so many things that can make a pregnancy high risk, and I think a lot of women are really scared if they get told that their pregnancy is high risk, and it doesn't necessarily mean that something bad is going to happen or that they're at risk, but really the purpose is to make sure that we're doing a thorough evaluation, making sure there's not more that we should be looking into, and then trying to optimize conditions to make the pregnancy as healthy as possible. And high risk means a whole host of different things. From a fetal perspective, having twins is obviously more high risk than having a singleton, or having a baby with an anomaly doesn't necessarily change the pregnancy and being high risk, but it means we should be prepared, make sure you know who's going to be taking care of baby afterwards and what that care looks like. There are certain maternal factors that go into it that we know if we take women with those factors and look at how their pregnancies go, we see more rates of high blood pressure, preterm delivery. And so we meet with them ahead of time, sometime during the pregnancy, to help just the other providers know what should I be monitoring for, what extra testing is available to make sure we try and have as healthy the pregnancy as possible. So I see women for a whole variety of reasons. The earlier, the better. When they're talking about come into your appointment, do your well woman exam, have those conversations of I want to get pregnant, so you can learn what things I should be doing. Is there something that might make me more high risk that I could actually manage before getting pregnant to lower all of those risks? So there's a lot of value in reaching out and communicating with your providers even before getting pregnant.
Yeah. And when we were discussing the difference between OB and midwives, touching on high risk, you might have more appointments. What does that look like, really?
Yeah, it really depends on the type of high risk condition you have, but there are certain conditions where baby's not growing as well. And we know that if we monitor babies once a week or twice a week, we can prevent stillbirth and prevent adverse outcomes. So we're going to make you come in a lot more. But if you're pregnant is high risk because in your prior delivery you delivered preterm, we're going to monitor you extra in a short period of time. And if everything looks good, you get to kind of continue routine prenatal care. So it can really vary depending on the condition.
And what was your personal draw and specialize more in this area?
I loved just the connection that I got to have with patients. So generalists, general OBs, the midwives, they get to follow patients for their whole life a lot of times, which I think there's great value, but I got to connect with patients in those really hard moments, have those hard conversations and be a support. And it a lot of times turns out really well, but there's really hard times, and just knowing that I'm trying to do my best to support them. And we hit some home runs and sometimes we don't connect with them as well as we'd like, but it's just knowing that we're providing that service to hopefully make them feel supported, help them feel connected, and provide them hope for future pregnancies as well.
I will tell you from a personal perspective, it goes so far because you wear it on your sleeve. And it's not just you, but so many providers at Essentia where I felt so taken care of and also like we're here for you.
Absolutely.
Thank you, Dr. Wyatt, so much. Okay, I've got a couple more questions where it's everybody all in. Okay, everybody jump in when you want to. Is there such thing as normal in women's health? Or is everybody just a tiny bit abnormal in some area?
Or are we all just normal?
Or are we all just normal? Ooh,
Normal variants.
normal variants?
I always say you're on the spectrum of normal.
I like that. Does every patient literally say, is this normal? Yes. Yes. What's one thing that you wish all women knew doing the podcast and having a guest on? If you've been a guest, you've heard me ask, do you have that little health nugget? What are you doing for yourself? And spoiler alert, sleep and exercise are said a whole lot in these podcasts. It's like they're important or something.
I think I touched on it a little bit, but I wish more women knew the importance of preconception kind of planning and just taking care of their health going into pregnancy can just make a big difference having those relationships with their providers beforehand. Folic acid, which is in prenatal vitamin, is meant to reduce neural tube defects. The neural tube closes by 5 to 6 weeks. So by the time you're pregnant, that folic acid isn't helping anymore. So like that's the education that our providers do. I think just provides so much value. So that's my nugget.
I always remind my patients to give themselves a little bit of grace, just like in the rest of our lives, parenting, relationships, whatever it may be. Sometimes we ignore our health, maybe on purpose, maybe not on purpose, and it is completely fine if you just get back on the horse and start wherever you can. So whether that's coming in for your annual and getting your pap smear done, or maybe it's finally admitting that you have a chronic disease that you haven't been taking care of and taking control of that. Anything changes your outcomes and your perspective, and come in and we will meet you where you're at.
In your guys' field, mental health, how often does that get woven into the patients that you see on a daily basis?
Almost every visit.
How do you see that show up? It's a safe place to do it.
I try to check in with my patients at every prenatal visit on how they're doing mentally, and then for sure for their annual exams as well.
Yeah.
Some of the problem visits obviously it doesn't come up, but the mental health right now it's definitely an issue. I don't know if there's any specialty you can practice in where you don't have to deal with it, because you think, I'm going to work in women's health OB, that's not my thing. There's no way you could work in this field and not have to be an expert in it, because we're helping women with that every day. Yeah, it's tough.
Sometimes for women, it's got to be the first time they've ever said it out loud. Anybody else have a take?
I feel like in the last couple of years, anxiety has become the biggest part, and I halfway joke that I wish Zoloft was in the prenatal vitamin because we all need it. It's become a bigger part, and we just need to talk about it more.
And then from there, hopefully you have the right advice.
Yeah, and I wish people didn't feel shameful for using medications too. I tell women all the time that it's not normal to feel defeated every day, depressed every day, sad every day. It's not normal to cry every day, and it's okay to take a pill.
One thing I've really seen come up a lot more recently is the women who describe their prior pregnancy or an event that happened as like traumatic. And I try and encourage women to like acknowledge, because a lot of the patients that I see did have a bad experience, a difficult experience before, and that can look a lot of different ways. But PTSD can be a real thing for some of these women in their pregnancy, and like helping them get through it so they can actually enjoy their pregnancy is one of the things that I've really learned to appreciate as part of my job. But I didn't expect it when I was at training. And over the past few years, I've really found a number of women and letting them know it's normal to feel those things.
Kind of goes into our baby blues talk versus postpartum depression. That seems like the closest correlation, but it's right. When you just have a caring individual asking, how are you? How's your mental state? So thank you for all being that type of provider to do that with your patients. I think that goes a long way. All right. We've allotted some social time after this. You guys were all amazing. You brought fresh and new insight in a different way, and you do it with some vulnerability. Really appreciate it.
Thank you, Corey.
Thank you. Thank you. Let's give them all a round of applause.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.